I actually founded VetSOAP back in 2012, and SOAP is obviously a SOAP note that the veterinarians write when they see a patient, but it also stands for Specialist Outreach and Awareness Project. And as someone who works with a lot of specialists and who has had a dog referred to a specialist from a primary care veterinarian, I was witnessing over and over again how there was a lot of frustration on clients' part that they weren't aware that specialists existed, and the veterinarian that they would go to was not always offering referral to a specialist as an option, and sometimes specialists were receiving cases where they felt it was a little bit too late and they could have done much more to help the patient had they been referred earlier. So what I was hoping to do in putting a group together to form VetSOAP was to help enhance the collaborative relationship between primary care veterinarians and specialists, and ultimately prove that referral and collaborative care is good for everybody. Certainly the patient, but we set out to do some research that would allow us to quantify with data the benefits to collaborative care. And we modeled it after a study done by veterinary cardiologist Bonnie Lefbaum and one of her colleagues, where they studied dogs with congestive heart failure, and they looked at a retrospective chart pull where some of those dogs were cared for by a primary care veterinarian alone, and some were co-managed by the primary care vet and the specialist. And they looked at longevity and revenue at the primary care practice. 74% greater longevity and 22% greater lifetime revenue value to the primary care vet. So we thought it would be worthwhile for us to look at several different disease states and determine, was this the case for a variety of types of illnesses? And ultimately the goal is to strengthen that collaborative relationship and help everyone see that collaborative care at an appropriate time within the disease process is ultimately going to benefit the entire profession.